You know, the pandemic has caused an alarming increase in childhood obesity. Margie Ellisor is here diving into this troubling topic in today's STL Mom segment.
Yeah, Randy, of course, we've been talking for years now about the increase in childhood obesity. Now the pandemic causing even more alarm. Dr. Denise Wilfley with the Center for Healthy Weight and Wellness at Washington University is joining us with more on a new study looking at this growing problem. Good morning to you.
Good morning.
Well, a recent study by the CDC points to the pandemic for a rise in cases. Why do you think COVID is having this impact?
There's been a real breakdown in structure and routines, and also a lot of kids have struggled with anxiety and depression during this time.
Yeah, we know obesity can have serious long-term health issues, but can it also bring a greater risk of illness when it comes to COVID-19?
It absolutely can. What we're finding is that children with obesity are more likely to be hospitalized and also more likely to have severe illness from COVID.
And you have a study. It's looking to reverse this jump in cases. Tell us more about what you're doing.
Yeah, what we're doing is we're partnering with pediatricians and the American Academy of Pediatrics to really assist providers in counseling for parents around prevention of excess weight gain in kids. And what we're really doing is working with them to foster healthy habits. And also we provide individual coaching for 50% of the families so that the parent learns tools and strategies to set their environment up for success for not only the child, but also the parent, so the parent can model these healthy eating and activity behaviors.
Dr. Wilfley, if parents have concerns about their child and possibly obesity, what can they do?
The most important thing is to really support the child, and we find that routines are very important, having 3 meals a day and 2 planned snacks, and also making sure that the child is actually able to get adequate sleep, because that's going to fuel better choices in terms of eating and activity behaviors, as well as setting up that structure within the home. So those are the main things, and also modeling. And then the other thing we do is make sure that not only within the home, but outside the home, that the parent works with the child to maximize the likelihood that they're exposed to healthy prompts for those healthy behaviors.
You mentioned being a role model. I mean, our kids are watching us, and they're watching what we put in our mouths. They're watching whether we're going out and we're exercising.
Absolutely. And the hard thing is that during the pandemic, it's been very hard on caregivers. They've had adequate times that they are being forced to work more hours. And so it's harder to do this. So first off, for a parent, be compassionate with yourself, but then realize that creating that structure and the modeling and providing those healthy prompts for eating and activity with the home really do set your whole family up for success.
And how can families learn more about the Team Up project?
They can go to jointeamup.org.
All right, very good. Dr. Denise Wilfley, thank you so much for your time this morning. We appreciate it.
Thank you.
And for more information as well on the Team Up project, we will link you at stlmoms.com.